Dr. Molly here. I'm a professor in the College of Health Professions at the University of Detroit Mercy and one of the co-founders of Associates in Primary Care. In this series of patient education, where we are trying to educate patients on some of their chronic diseases because we think that if the patients can understand their disease, they're going to be able to better manage their disease and then reduce their risk. This is the third in our diabetes type 2 series. This is only for type 2 diabetics and pre-diabetics. This does not apply to type 1 diabetes or gestational diabetes. But if you've got pre-diabetes or type 2 diabetes, this is for you. If you're pre-diabetic, you can prevent type 2 diabetes. If you have type 2 diabetes, most of the time it is reversible. So this series is going to talk about the risk factors of type 2 diabetes. What is putting you at risk for developing this disease? If you want to know about the disease, go back and look at the overview series. If you want to know the symptoms that might pop up that would indicate that you have it, go back and read the symptoms or listen to the symptoms series. This one is talking about your risk factors. What puts you at higher risk for type 2 diabetes compared to somebody else? One of the biggest things is being overweight. And we've done a series already on overweight and obesity. So go back and look at that video to figure out exactly what does that mean when I say being overweight or obese. People that have overweight and obesity are at very, very high risk for developing type 2 diabetes. If you've had a close family member, a parent or a sibling diagnosed with type 2 diabetes, you're at higher risk. Now, if you have a family member that was diagnosed with type 1 diabetes, that does not do anything to increase your risk for type 2 diabetes. Because again, those are two completely different diagnoses. If you've had diagnosed with prediabetes, you're much more likely to develop type 2 diabetes. If you've had gestational diabetes, now you're at higher risk for developing type 2 diabetes. People that have a sedentary lifestyle, people that have non-alcoholic fatty liver, because as you have overweight and obesity, some of those fat deposits will deposit in the liver. The liver has a lot to do with type 2 diabetes because your liver produces glucose. It does this thing called gluconeogenesis. It produces glucose. And in type 2 diabetics, you've got too much glucose anyways. So if your liver is not working well, that's going to increase your risk for developing type 2 diabetes. As you age, this is a disease that typically shows up over the age of 45. So as you age, and if you have all of those other risk factors that I just talked about, that's going to increase your risk for developing type 2 diabetes. So these are just some of the risk factors that if you are aware of, you can start mitigating. And if you mitigate that risk, you're going to reduce your chances of developing type 2 diabetes. Obviously, you can't change things like, if you had a dad that had type 2 diabetes, you can't fix that. But you can definitely fix how much you're eating. You can lose weight. You can start exercising more. And all of those things combined are going to reduce your risk of developing type 2 diabetes. If you reduce your risk, you're improving your health. And you're going to reduce your risk of all the other things that are associated with type 2 diabetes, like kidney disease, neuropathies, heart disease, stroke, all the other things that we know is associated with a diagnosis of type 2 diabetes. So those are the risk factors. If you have some of them and you've also got type 2 diabetes or you're trying to prevent it, there you go. You can